Hey, how are you doing? I want to ask you something very important today, and I want you to be really honest with yourself as you answer. Have you ever noticed your legs feeling unusually heavy at the end of the day? Maybe some swelling around your ankles? Or perhaps you felt a cramping, aching pain in your calves when you walk, and the moment you sit down and rest, it goes away? Now, here's what most people say when they notice these things. They say, that's just my age. I'm over 60. That's what happens. And I'm here to tell you today, that is one of the most dangerous assumptions you can make about your own health. Because those symptoms, they are not just normal aging. In many cases, they are your body sending you a very specific distress signal. Your legs are literally trying to tell you something important. And if you don't know how to listen, you could be missing a warning that has the potential to save your life. Today, I'm going to walk you through the 3 most critical warning signs of poor leg circulation that people over the age of 60 need to know about. We're talking about warning signs that are connected to conditions like peripheral artery disease, deep vein thrombosis, and chronic venous insufficiency. Conditions that, if left unaddressed, can lead to serious complications, including stroke, heart attack, and in the most severe cases, amputation. So please, stay with me all the way through this video. Share it with your family, share it with your friends, because this information is that important. Let's get into it. Before we get to the warning signs themselves, I want to give you just a quick, simple picture of what's actually happening in your legs when circulation is healthy and what changes when it's not. Your heart is a pump. Every single beat pushes oxygen-rich blood outward through your arteries, all the way down to your toes. Once that blood delivers its oxygen and nutrients to your cells, it has to make the return trip back up to your heart through your veins. Now that return trip from your feet all the way back up to your heart, that's actually a remarkable feat. It's going against gravity. And what helps make that possible are tiny little valves inside your veins that act like one-way doors. They allow blood to move upward and prevent it from falling back down. Here's the problem. As we age, especially after 60, several things start to work against this beautiful system. The walls of our arteries become stiffer and less flexible. Those little valves in our veins can weaken and start to fail. We tend to be less physically active, and many of us are managing health conditions like diabetes, high blood pressure, or high cholesterol, all of which put additional strain on our blood vessels. The result? Blood doesn't move through your legs as efficiently as it used to, and when that happens, your body starts sending you signals. Those signals are what we're talking about today, so let's go through each one. The first warning sign is one that I hear about from patients all the time, and it's one that almost everyone tries to explain away. Persistent swelling, heaviness, and cramping in the legs. Now, let's be specific about what I mean here, because there's an important difference between the kind of swelling that's just a normal response to a long day on your feet and the kind of swelling that's telling you something is wrong. We've all had the experience of standing or sitting for a long time and noticing that our ankles look a little puffy by evening. You put your feet up, you get a good night's sleep, and by morning, it's gone. That's your body doing what it's supposed to do. But what I'm talking about is different. I'm talking about swelling that comes back day after day. Swelling that doesn't fully go away even after a night of rest. I'm talking about legs that feel heavy, like you're wearing lead boots, even first thing in the morning when you haven't been on your feet yet. And I'm talking about cramping, that painful seizing sensation in your calves, often at night, that wakes you up out of a sound sleep. So what's actually causing this? When the veins in your legs aren't working efficiently, When those little one-way valves start to fail, blood begins to pool and collect in the lower legs, instead of returning to the heart the way it should. As that blood pools, it increases the pressure inside the vein walls. And when that pressure gets high enough, fluid starts to leak out of the veins and into the surrounding tissue. That fluid is what you're seeing as swelling. This condition, when the veins are chronically unable to return blood efficiently, has a medical name. It's called chronic venous insufficiency, or CVI, and it is extremely common in people over 60. In fact, studies suggest that CVI affects somewhere between 15 and 40% of adults, and that number climbs significantly with age. The heaviness and the nighttime cramping? Those are often signs that your muscles and tissues are not getting enough fresh, oxygenated blood, and they're reacting to that deficiency. Now, here's where I need to talk to you about something more serious. If you notice that one leg, just one, becomes suddenly and significantly swollen, particularly if it's red, warm to the touch, or painful, I need you to take that very seriously. That combination of symptoms can be a warning sign of a deep vein thrombosis, a blood clot that is formed in a deep vein, most often in the calf or thigh. A DVT is a medical emergency. If that clot breaks loose and travels to your lungs, it becomes what's called a pulmonary embolism, and that can be life-threatening. So please, if you have sudden, one-sided swelling with redness or pain, do not wait. Call your doctor or go to the emergency room. Similarly, if you have leg swelling that comes with shortness of breath or chest discomfort, that needs immediate attention because it may be related to your heart. So what can you do at home right now? First, a simple exercise called the ankle pump. You can do this right now, sitting in your chair. Simply flex your foot up toward you, then point it down. Up and down. Up and down. Do that 20 to 30 times, several times throughout the day. This activates the calf muscles, which act as a secondary pump for your venous circulation, and helps push that pooled blood back up toward the heart. Second, elevation. When you're resting, try to elevate your legs so that your feet are above the level of your heart. Even 15 to 20 minutes a couple times a day can make a meaningful difference in how much fluid accumulates in the lower legs. And third, talk to your doctor about graduated compression stockings. These are specially designed stockings that apply gentle pressure to the legs, greatest at the ankle, tapering off as it goes up, and they are one of the most effective non-medication tools we have for supporting venous return in the legs. The second warning sign involves something you can actually see and feel with your own hands: changes in the color, temperature, and texture of the skin on your legs and feet. Your skin is a remarkable indicator of what's going on beneath the surface. When circulation is healthy, skin receives a steady supply of oxygen and nutrients from the blood flowing through tiny capillaries just beneath the surface. That keeps your skin warm, well-nourished, and resilient. But when circulation is compromised, when blood isn't reaching the skin the way it should, you start to see and feel changes that are very telling. Let me describe some of the specific things to watch for. First, color changes. Healthy skin on the legs should be relatively consistent in tone. Poor circulation can cause the skin to appear pale or whitish, especially when the leg is elevated, and then turn a deep red or bluish purple when you let it hang down. You might notice a persistent redness or a brownish discoloration, particularly around the ankles and lower legs. This brownish staining, which doctors sometimes call hemosiderin deposition, happens when red blood cells leak out of the veins into the skin tissue and break down. It's a classic sign of chronic venous disease. If your foot or lower leg takes on a blue or purple color even at rest, and even when you're warm, that is a significant warning sign that needs medical evaluation. Second, temperature changes. Feel your legs and feet. Are they noticeably colder than the rest of your body? Cold feet and legs, particularly when one foot or leg is colder than the other, can be a sign that arterial blood flow to that limb is reduced. This is very common in peripheral artery disease, which I'll talk more about in a moment. Third, texture and surface changes. When the skin on your legs isn't receiving enough blood flow, it loses its vitality. You might notice the skin becoming unusually dry, thin, or shiny, almost like tissue paper. You might notice that the hair on your lower legs and feet has thinned out significantly or stopped growing altogether. And your toenails may grow more slowly and become thick or brittle. These aren't cosmetic issues. These are signs that the tissue in your leg is not getting what it needs to stay healthy. Fourth, and this is critically important, wounds or sores that don't heal. If you develop a cut, blister, or sore on your foot or lower leg, and it does not show clear signs of healing within 2 weeks, that is a red flag. Poor circulation means the tissue cannot receive the blood flow it needs to repair itself. These wounds can worsen rapidly into deep ulcers, and in severe cases can progress to tissue death, which is known as gangrene. For those of you living with diabetes, I want to speak to you directly for a moment. Diabetic patients face a double challenge: poor circulation and peripheral neuropathy, meaning you may have reduced sensation in your feet and not feel a wound even as it gets worse. This is why doctors recommend that every diabetic patient inspect their feet every single day. Look between your toes, check your heels. You are looking for any redness, any cracking, any sore, any swelling, anything that wasn't there the day before. Now, let me explain what's behind many of these skin changes. The condition most often responsible for the arterial side of these symptoms is called Peripheral Artery Disease, or PAD. PAD occurs when plaque, that buildup of cholesterol, fat, calcium, and other substances, accumulates inside the walls of the arteries that supply blood to your legs. This narrows the arteries and reduces the flow of blood to the lower limbs. PAD is far more common than most people realize. It affects approximately 8 to 12 million Americans, and it is significantly more prevalent in people over 60, people with diabetes, people with high blood pressure, and smokers. One of the best ways to screen for PAD is a simple, painless test called the Ankle Brachial Index, or ABI. Your doctor places blood pressure cuffs on your arms and your ankles and compares the readings. It takes just a few minutes and can tell you a great deal about whether arterial flow to your legs is normal. I strongly encourage anyone over 60 to ask their doctor about this test, especially if you have any of the risk factors I mentioned. What can you do for your skin and circulation starting today? Keep your skin moisturized. Dry, cracked skin is an entry point for infection. Avoid going barefoot, especially outdoors or on hard floors. Wear well-fitted, comfortable shoes that protect your feet. And please, discuss the ABI test with your healthcare provider at your next visit. And now we come to the third warning sign, and in many ways, the most classic and recognizable signal of serious arterial disease in the legs. Pain while walking that goes away when you stop and rest. Let me describe this pattern for you because it is very specific and very distinctive. You start walking. Maybe you're going to the mailbox, or walking through the grocery store, or strolling around the block. After a certain distance, maybe a few hundred feet, maybe half a block, maybe less, you start to feel an aching, cramping, or squeezing sensation in your calf, maybe in your thigh, maybe in your buttock. It might feel like a deep fatigue, or like someone is wringing out your muscle like a wet towel. And then you stop. You stand still for a minute or two, and the pain melts away completely. You feel fine. So you start walking again, and after about the same distance, the pain comes back. This cycle, walk, pain, stop, relief, walk again, has a medical name. It's called intermittent claudication, and it is the hallmark symptom of peripheral artery disease at a moderate stage. Now, this is where I want to make a very important point, because I know what many of you are thinking. You're thinking, oh, I've had that. I just figured it was my arthritis acting up, or a muscle strain, or just my knees getting older. And I completely understand why you'd think that. The pain is in your leg. It comes with walking. It goes away with rest. It makes total sense to attribute it to joints or muscles. But here's the critical difference. Arthritis pain and joint pain typically do not follow this strict pattern of appearing at a predictable point during exertion and reliably disappearing with just a minute or two of rest. Claudication is uniquely associated with exertion-related blood flow demand that the narrowed arteries simply cannot meet. Here's the mechanism, and it's actually quite logical once you understand it. When you're sitting still, your leg muscles don't need very much blood. The narrowed arteries, even with their reduced capacity, can supply just enough to keep everything functioning at rest. But the moment you start walking and those muscles begin working hard, they send out a signal. We need more oxygen. We need more blood. Send it now. But the arteries can't respond. They're too narrow. They're blocked by plaque. So the muscles start to work in an oxygen-deficient state, and that is what generates the pain. When you stop and rest, the demand drops back down, the available blood flow catches up, and the pain disappears. Understanding the stages is important. In the early stages, claudication might only happen when you walk long distances. You can still get to the end of the street and back without trouble. This can be deceptive because it feels manageable. Many people simply adjust their lives around it. They park closer. They take elevators. They stop going for those morning walks. And all the while, the underlying disease continues to progress. In moderate stages, the distance before pain sets in becomes shorter and shorter. Where you could once walk a block, now you can barely manage 50 feet. In the severe stages, a condition called critical limb ischemia, the pain is present even when you are not walking. It wakes you up at night. And there is a well-known sign associated with this stage. The pain in the foot or toes is somewhat relieved when you hang your foot off the edge of the bed, because gravity helps pull a tiny bit more blood down into the extremity. If you find yourself doing this instinctively, hanging your foot off the bed at night for relief, please see a vascular specialist. That is a serious sign. I also need you to understand the broader cardiovascular implications of PAD. The same disease process, atherosclerosis, the buildup of plaque, that is narrowing the arteries in your legs, is very likely also present in other parts of your body. Research consistently shows that people diagnosed with peripheral artery disease have a 2 to 3 times higher risk of heart attack and stroke compared to people without PAD. This is why PAD is not just a leg problem. It is a whole body vascular disease, and it deserves to be treated with the same seriousness as coronary artery disease. So what do you do? First, the most important thing you can do if you smoke is to stop. Smoking is the single most powerful accelerant of peripheral arterial disease. The chemicals in cigarette smoke damage the lining of blood vessels, accelerate plaque formation, and cause arteries to constrict. The research on this is overwhelming and unambiguous. If you smoke and you have any of the symptoms I've described today, quitting is the most impactful step you can take for your vascular health. Second, here's something that might surprise you. One of the most effective treatments for intermittent claudication is a supervised walking program. I know, you're thinking, Dr. Mandell, you just told me walking causes the pain. Why would I walk more? And the answer is fascinating. When you exercise your legs consistently, even through the claudication, your body responds by developing new, smaller collateral blood vessels that create alternate routes around the blockages. This process is called arteriogenesis, and it can meaningfully improve your walking distance and quality of life over time. Third, talk to your doctor. There are medications that can help. There are procedures, like angioplasty or stenting, that can open up narrowed arteries. And there are surgical options for severe cases. The important thing is to get evaluated so you know where you stand and what your options are. All right, let's bring this all together, because I never want to leave you with just a list of things to be afraid of. I want to leave you with a plan of action. Here are the things you can start doing today to support better circulation in your legs and protect your vascular health as you age. Number 1, walk every day. Even 20 to 30 minutes of gentle daily walking is one of the most powerful things you can do for your circulation. Movement is medicine. It stimulates blood flow, helps maintain healthy blood vessel function, and, as I mentioned, can even help your body build new blood pathways around blockages. Number 2, stay hydrated. This one is so simple and so often overlooked. When you're well hydrated, your blood has a better consistency. It flows more smoothly. Many older adults are chronically mildly dehydrated without realizing it. Aim for 6 to 8 glasses of water per day and more in warm weather or after exercise. Number 3, elevate your legs regularly. Spend 15 to 20 minutes a couple times a day with your feet elevated above the level of your heart. This is especially important in the evening. It helps drain pooled fluid from the lower legs and gives your venous system a break from fighting gravity. Number 4, reduce sodium and refined sugar in your diet. Excess sodium causes fluid retention, which makes swelling worse. And excess sugar damages blood vessel walls and accelerates atherosclerosis. Small, consistent dietary changes add up to significant protection over time. Number 5, get a vascular health checkup. Ask your doctor specifically about the ankle brachial index test. Ask them to look at your legs if you've noticed any of the changes we discussed today. Don't wait for your doctor to bring it up. Advocate for yourself. Number 6, if you smoke, please stop. I know I've said this already, but it bears repeating. There is no intervention, no medication, no surgery, no supplement that will have as profound a positive impact on your leg circulation as stopping smoking. On the subject of supplements, I do want to mention that omega-3 fatty acids found in fish oil have meaningful evidence supporting their role in cardiovascular and vascular health. Magnesium plays an important role in blood vessel relaxation and muscle cramping. And vitamin E has antioxidant properties that may support vessel wall health. As always, please discuss any supplements with your own doctor before starting them, particularly if you're on blood thinners or other medications. So let's quickly recap what we covered today. Warning sign number 1: persistent swelling, heaviness, and cramping in the legs. Your veins are struggling to return blood to your heart. Don't dismiss it. Elevate, pump those ankles, consider compression, and see your doctor if one leg suddenly swells. Warning sign number 2: changes in skin color, temperature, and texture. Your skin is a window into your circulation. Pale, cold, or discolored legs, especially slow-healing wounds, need medical attention. Get that ABI test. Warning sign number 3: pain when you walk that stops when you rest. That is intermittent claudication. That is your arteries telling you they are narrowed and struggling. It's connected to heart attack and stroke risk. Please do not ignore it. Your legs have carried you through every step of your life. They have taken you to work, to your children's schools, to your grandchildren's birthday parties. They deserve your attention and your care. You now have the knowledge to recognize when something is wrong. Use it, share it. Be your own health advocate, and be an advocate for the people you love. As always, I am Dr. Alan Mandell. God bless you all. Take care of those legs, take care of your health, and make it a great day.